Certified Medical Administrative Assistant. Upon completion of the course, the student should be able to articulate the main roles and responsibilities of the medical office assistant, including administrative, clinical, and general. Identify different types of medical institutions and medical offices. Understand personal, professional, medical, legal, and bioethical standards and the importance of safeguarding confidentiality. Define acceptable office behavior, including proper telephone etiquette, and the importance of patient sensitivity and confidentiality. Define medical malpractice, abandonment, fraud, and abuse. Be able to distinguish among the 5 drug schedules of controlled substances. List procedures for scheduling and referring patients and handling walk-in emergency patients. Identify and discuss at least 3 important interpersonal skills. Identify and become familiar with the various types of written correspondence in a medical office. Create a block-style letter that conforms to all formatting requirements. Understand what is required to create and submit a medical bill. Define a release of medical information, explanation of benefits, assignment of benefit, and electronic remittance advice. Develop an understanding of the term HMO, and be able to interpret the information contained on the patient's insurance card. Define the terms and distinguish among express, implied, and informed consents. Understand the financial terms and procedures involved in operating a medical office practice, including income, expense, accounts receivable, accounts payable, cash, and accrual accounting, write-off adjustments. Define safety and infection control standards and procedures in a medical office. Demonstrate the awareness of HIPAA compliance, confidentiality laws, PHI. Create a personal resume and cover letter incorporating the new medical office skills and concepts developed through this course. Description. This course prepares students for the administrative skills medical administrative assistants need to know. This program integrates all of the front office topics and skills competencies required for today's industry standards. This program also covers material dealing with medical office, medical records, management skills, client service skills and responsibilities, client education and legal ethical issues. Course prerequisites: none. Method of instruction. This course utilizes a lecture and demonstration methodology. This course covers the following topics: Introduction to Healthcare. This is an introductory course that explores the roles and responsibilities associated with today's medical office environment. Various medical specialties of allied healthcare workers, physician specialties, and hospitals will be explored. Students will gain an understanding of the hospital environment, the physician's office, clinics, and other medical facilities. Introduction to Health Insurance. Introductory course that gives an overview of the insurance industry. Concepts such as what is health insurance, disability and liability insurance, major developments in health insurance, and third-party reimbursement methods. This is a course designed to introduce the students to a medical insurance claims process. Students will learn developments of the claim, insurance company processing of a claim, and maintaining insurance claim files. This course is an introduction to the health insurance process and is not intended to satisfy requirements for the Certified Billing and Coding Specialist program. Students are not eligible for the CBCS certification. Medical Terminology. This course introduces students to medical terminology and includes an overview of anatomy and physiology, medical history, examination procedures, and medical reports. The course also covers terminology related to diseases, diagnostic tests, and treatment of body systems. Students will also learn terminology related to radiology, pathology, autopsies, mental health, and discharge summaries. Objectives. Upon successful completion of the course, students will 1. Begin developing a medical vocabulary through a study of root words. 2. Begin developing a medical vocabulary through a study of prefixes and suffixes. 3. Students will develop practices of correct pronunciation and usage of terms. 4. Students will develop an understanding related to the following body systems: A. Integumentary, B. Musculoskeletal, C. Circulatory, D. Lymphatic, E. Cardiovascular, F. Respiratory, G. Digestive, H. Urinary, I. Reproductive, J. Endocrine, K. Nervous, L. Senses, eye, ear, and throat. Medical Laws and Ethics. This course examines the role of the Certified Medical Administrative Assistant and the laws that relate to this role. Special emphasis on OSHA regulations relating to the front office, HIPAA compliance, employer and employee liability, Patient Bill of Rights, Americans with Disabilities Act, and fraud. Objectives. Upon successful completion of this course, the student will 1. Define roles and responsibilities related to the Certified Medical Administrative Assistant, CMAA. 2. Discuss the principles of medical ethics as they apply to both the CMAA and the physician. 3. Discuss the patient's Bill of Rights and responsibilities in receiving medical care. 4. Demonstrate understanding of the HIPAA compliance and person health information, PHI. 5. Demonstrate understanding of OSHA regulations. 6. Demonstrate understanding of the Americans with Disabilities Act. 7. Demonstrate understanding of employee-employer liability. Introduction to Computers. This course is designed to familiarize the student with primary computer skills. Students will begin with key components, hardware of the computer. This course will start the fundamentals of the computer system and advance to the basics of the software of the computer. Students will learn fundamentals of computer software, storage systems, backup systems, internet, intranet, and the concepts of computer networks. Objectives. Upon completion of this course, the student will 1. Properly identify the key components of the computer. 2. Demonstrate ability to turn the computer on and off correctly. 3. Demonstrate ability to use the mouse correctly. 4. Demonstrate the ability to turn the monitor on and off correctly. 5. Demonstrate the ability to turn the printer on and off. 6. Describe a modem and its function. 7. Correctly label the parts of the computer, CD-ROM, floppy disk, and explain their use. 8. Explain the terms, operating system, application programs, and software compatibility. 9. Explain computer networks, electronic mail, and the Internet. 10. Explain professional behavior regarding the Internet. 11. Explain professional behavior and security regarding computers. Business writing and communication. This course is designed to introduce the student to basic concepts and skills for the office environment. Student will learn the principles of written communication needed to communicate effectively in a medical environment by composing business letters, memos, and reports. Students will develop proofreading skills, review grammar, spelling, and vocabulary. Objectives. Upon successful completion of this course, the student will 1. Demonstrate understanding of the format of a business letter. 2. Demonstrate the ability to create a business letter in 2 formats. 3. Students will demonstrate the ability of using reference books, such as a dictionary and a thesaurus. 4. Students will demonstrate understanding of rules of grammar. 5. Students will demonstrate understanding of special rules and improved spelling. 6. Students will demonstrate improved vocabulary. 7. Demonstrate understanding of proofreading, editing, and corrections. 8. Students will develop understanding of proofreader's marks. 9. Student will improve proofreading skills. 10. Students will demonstrate the ability to proofread and edit a report. Medical keyboarding. This course is designed to teach the student keyboarding skills via the computer. Students will learn the typing skills necessary to learn the alpha and numeric keyboards. Students will utilize drill practice to gain speed and accuracy. Emphasis will be placed on medical reports, terminology, and other types of documentation essential in a medical office environment. Objectives. Upon completion of this course, the student will 1. Define the parts of functions of the computer keyboard. 2. Demonstrate the understanding of function keys, spacebar, enter, and letter keys. 3. Demonstrate proper finger and hand placement on keyboard. 4. Utilize all 10 fingers while typing. 5. The student will be able to demonstrate ability to type without looking at keyboard at a speed of 20 words per minute, with no more than 3 errors. 6. The student will demonstrate understanding of the numeric keypad. 7. The student will demonstrate ability to create a business letter in 2 formats. 8. The student will demonstrate ability to create a letter of collection. 9. The student will demonstrate the ability to create an invoice for collection using tab numbers. Fundamentals of mathematics. Students will review basic math topics and common application for the medical office. 1. Student will demonstrate ability to perform simple mathematic functions, addition, subtraction, multiplication, and division. 2. Students will demonstrate ability to perform simple mathematic functions of addition and subtraction of decimals. 3. Demonstrate ability to solve word problems involving decimals and percentages. 4. Demonstrate ability to solve numeric and word problems involving common situations in the medical office. Accounting and Finance for the Medical Office. This course is designed to introduce bookkeeping and the basic accounting skills needed in a medical office practice. Students will learn about banking services and procedures. The emphasis of this hands-on office simulation is accuracy and confidentiality of medical office records. The student will assume the role of the medical office professional and will be learning various tasks required in posting and tabulating patient financial records. Computer applications. This course is designed to provide students with a basic understanding of a window-based environment and word processing using Microsoft Word. Students will learn to create, edit, retrieve, and produce documents via various hands-on applications. Students will also be introduced to spreadsheet concepts using Microsoft Excel applications. Students will be given an opportunity to improve speed and accuracy on the computer keyboard. Objectives. Upon successful completion, the student will 1. Be able to create, edit, and print a document. 2. Demonstrate ability to format, set margins, and set tabs on a document. 3. Demonstrate ability to move, copy text, and find, replace text. 4. Demonstrate ability to open and edit documents and manage files. 5. Demonstrate ability to create a document utilizing different fonts within the document. 6. Demonstrate the ability to create a basic spreadsheet. 7. Demonstrate understanding of formulas and formatting data. 8. Demonstrate ability to print selections from spreadsheets. 9. Demonstrate ability to change fonts, colors, and patterns of cell borders. 10. Demonstrate ability to create, name, and edit spreadsheets. 11. Demonstrate ability to enter data utilizing only numeric pad. Customer service for the healthcare professional. This course is the study of effective patient relations and the skills that need to be mastered to provide quality customer service to patients and other healthcare workers. Students will learn professionalism needed to speak with the patients and other healthcare workers and will develop mastery of appropriate behaviors needed for the medical office. Students will learn telephone skills, answering calls, messages, and how to handle irate patients. Special emphasis will be placed on cultural differences, oral communication, effective speaking, verbal and nonverbal communication, teamwork with coworkers, soft skills. Objectives. Upon successful completion of this course, the student will 1. Demonstrate understanding of verbal and nonverbal communication. 2. Demonstrate appropriate telephone techniques. 3. Demonstrate message taking by creating messages. 4. Demonstrate ability to handle various customer calls. 5. Demonstrate understanding of active listening. 6. Demonstrate ability to manage a multi-line phone. 7. Demonstrate appropriate HIPAA protocols when answering questions. 8. Demonstrate understanding of cultural differences among various groups. 9. Demonstrate understanding the roles of the CMAA and other health professionals. 10. Demonstrate the ability to assist special needs customers. Medical office skills. 1. This course is designed to teach the student the protocols of new patient interview and check-in procedure, established patient return visit, post-clinical checkout procedure. Students will gain an understanding of concepts such as pre-authorization and the SMART card. Students will learn how to schedule appointments, record management, preparing medical records. Students will learn how to arrange medical meetings and travel arrangements. Medical documentation. Students will gain a thorough understanding of the medical documentation process. Students will learn the guidelines for documentation, medical records, and laws governing privacy of medical documents. Students will learn how to prepare medical reports in the proper format, interpretation of medical chart, concentration, medical office workflow, medical record management, correspondence, communications. Objectives. Upon completion of this course, students will 1. Discuss parts of the medical record. 2. Demonstrate the ability to create a new chart. 3. Demonstrate the ability to file medical records using various filing formats. 4. Differentiate between new patient, established patient, and follow-up. 5. Define new patient emergency visits, established patient emergency visit, emergency situations. 6. Discuss history and physical. Styles and formats. 7. Identify physical exam data. 8. Demonstrate how to enter data correctly onto a patient chart. 9. Differentiate between the various types of medical reports transcribed. 10. Identify the format needed for each of the medical reports. 11. Interpret a chart and prepare the medical report. 12. Create reports, discharge summary, operative reports, consultation report, medico-legal reports. Career development. This optional course will prepare the students to identify and evaluate career opportunities, locate potential employers, and prepare for job interviews. Objective. At the conclusion of this course, student will 1. Present an acceptable resume. 2. Present an acceptable cover letter and/or fax cover sheet. 3. Present themselves in a professional manner for interviews. 4. Understand the role of the interviewer and the interviewee. 5. Demonstrate appropriate interview behavior. 6. Demonstrate the ability to review and respond to appropriate help wanted ads in the newspaper. 7. Demonstrate ability to conduct an internet search for jobs within their field. 8. Present a thank you note written for the interviewer. Clinical medical assisting. Medical assistants work primarily in ambulatory settings such as medical office and clinics. Medical assistants function as members of the healthcare delivery team and may perform administrative and/or clinical procedures. Administrative duties include scheduling and receiving patients, preparing and maintaining medical records, performing basic secretarial skills and medical transcription, handling telephone calls and writing correspondence, serving as a liaison between the physician and other individuals, and managing practice finances. Duties. A. Display professionalism. B. Apply communication skills. C. Demonstrate keyboarding skills and computer awareness. D. Perform business software applications. E. Work with computer operating environments. F. Perform administrative duties. G. Apply legal, ethical, and confidentiality concepts to practice. H. Manage the office. I. Provide patient instruction. J. Manage practice finances. Description. This program is designed to teach students the skills necessary for employment in the modern medical facility. A qualified medical assistant is capable of performing a wide range of duties, with a variety of technical detail, thus helping the physician in many clinical situations. Upon successful completion of this course, students set for a national certification exam. Significant points. Some medical assistants are trained on the job, but many complete 1- or 2-year programs in vocational technical high schools, post-secondary vocational schools, and community and junior colleges. Medical assisting is projected to be the fastest growing occupation over the past decade. Job prospects should be best for medical assistants with formal training or experience, particularly those with certification. Nature of the work. Medical assistants perform routine administrative and clinical tasks to keep the offices of physicians, podiatrists, chiropractors, and other health practitioners running smoothly. They should not be confused with physician assistants who examine, diagnose, and treat patients under the direct supervision of a physician. The students of medical assistants vary from office to office, depending on the location and size of the practice and the practitioner's specialty. In small practices, medical assistants usually are generalists, handle both administrative and clinical duties, and reporting directly to an office manager, physician, or other health practitioner. Those in large practices tend to specialize in a particular area under the supervision of department administrators. Medical assistants perform many administrative duties, including answering telephones, greeting patients, updating and filing patients' medical records, filling out insurance forms, handling correspondence, scheduling appointments, arranging for hospital admission and laboratory services, and handling billing and bookkeeping. Clinical duties vary according to state law and include taking medical histories and recording vital signs, explaining treatment procedures to patients, preparing patients for examination, and assisting the physician during the examination. Medical assistants collect and prepare laboratory specimens or perform basic laboratory tests on premises, dispose of contaminated supplies and sterilize medical instruments. They instruct patients about medications and special diets, prepare and administer medications as directed by a physician, authorize drug refills as directed, telephone prescriptions to a pharmacy, draw blood, prepare patients for X-rays, take electrocardiograms, remove sutures, and change dressings. Medical assistants also may arrange examining room instruments and equipment, purchase and maintain supplies and equipment, and keep waiting and examining rooms neat and clean. Assistants who specialize have additional duties. Pediatric medical assistants make casting of feet, expose and develop X-rays, and assist podiatrists in surgery. Ophthalmic medical assistants help ophthalmologists prepare eye care. They conduct diagnostic tests, measure and record vision, and test eye muscle function. They also show patients how to insert, remove, and care for contact lenses, and they apply eye dressings. Under the direction of the physician, ophthalmic medical assistants may administer eye medications. They also maintain optical and surgical instruments and may assist the ophthalmologist in surgery. Working conditions. Medical assistants work in well-lighted, clean environments. They constantly interact with other people and may have to handle several responsibilities at once. Most full-time medical assistants work at a regular 40-hour week. Some work part-time evenings or weekends. Employment. Medical assistants held about 365,000 jobs in 2002. Almost 60% worked in offices of physicians. About 14% worked in public and private hospitals, including inpatient and outpatient facilities. And almost 10% worked in offices of other health practitioners, such as chiropractors and podiatrists. The rest worked mostly in outpatient care centers, public and private educational services, other ambulatory healthcare services, state and local government agencies, medical and diagnostic laboratories, nursing care facilities, and employment services, training, other qualifications, and advancement. Most employers prefer graduates of formal programs in medical assisting. Such programs are offered in vocational technical high schools, post-secondary vocational schools, and community and junior colleges. Post-secondary programs usually last either 6 months, 1 year, resulting in a certificate or diploma. or 2 years resulting in an associate degree. Courses cover anatomy, physiology, and medical terminology, as well as typing, transcription, record-keeping, accounting, and insurance processing. Students learn laboratory techniques, clinical and diagnostic procedures, pharmaceutical principles, the administration of medications, and first aid. They study office practices, patient relations, medical law, and ethics. Accredited programs include an internship that provides practical experience in physicians' offices, hospitals, and other healthcare facilities. Formal training in medical assisting, while generally preferred, is not always required. Some medical assistants are trained on the job, although this practice is less common than in the past. Applicants usually need a high school diploma or equivalent. Recommended high school courses include mathematics, health, biology, typing, bookkeeping, computers, and office skills. Volunteer experiences in the healthcare field also are helpful. Although medical assistants are not licensed, some states require them to take a test or a course before they can perform certain tasks, such as taking x-rays. Employers prefer to hire experienced workers or certified applicants who have passed a national examination, indicating that the medical assistants meet the certain standards of competence. The American Association of Medical Assistants, National Healthcare Association, and other certifying bodies award the Certified Medical Assistant credential. The American Medical Technologists award the Registered Medical Assistant credentials. The American Society of Pediatric Medical Assistants awards the Pediatric Medical Assistant Certified Credential, and the Joint Commission on Allied Health Personnel in Ophthalmology award credentials at 3 levels: Certified Ophthalmic Assistant, Certified Ophthalmic Technician, and Certified Ophthalmic Medical Technologist. Medical assistants deal with the public. Therefore, they must be neat and well-groomed and have a courteous, pleasant manner. Medical assistants must be able to put patients at ease and explain physicians' instructions. They must respect the confidential nature of medical information. Clinical duties require a responsible level of manual dexterity and visual acuity. Medical assistants may be able to advance to office manager. They may qualify for a variety of administrative support occupations or may teach medical assisting. With additional education, some enter other health occupations, such as nursing and medical technology. Job outlook. Employment of medical assistants is expected to grow much faster than the average for all occupations through the year 2020 as the health service industry expands because of technological advances in medicine and growing and aging population. Increasing utilization of medical assistants in the rapidly growing healthcare industries will result in fast employment growth for the occupation. Employment growth will be driven by the increase in the number of group practices, clinics, and other healthcare facilities that need a high proportion of support personnel, particularly the flexible medical assistant, who can handle both administrative and clinical duties. Medical assistants work primarily in outpatient settings, which are expected to exhibit much faster than average growth. In view of the preference of many healthcare employers for trained personnel, job prospects should be best for medical assistants with formal training or experience, and particularly for those with certification. The course covers the following topics. Fundamental of Medical Assisting. This is an introductory course for the Medical Assistant program. The course places emphasis on patient-centered assessment, examination, intervention, and treatment as directed by a physician. It includes vital signs, collection and documentation of patient information, asepsis, minor surgical procedures, and other treatments appropriate for the medical office. Medical office procedures and customer service will be discussed. Administrative and clinical competencies are presented. Students will be required to demonstrate proficiency in these skills. Psychological aspect of patient care. This course provides a student with skills important to effective communication as it relates to patient care. Emphasis is placed on the effective verbal, nonverbal, written communication skills. Leadership teamwork strategies for relating to patients and families should be emphasized. Medical anatomy and physiology. This course is a study of human anatomy and physiology. Lectures systematically take the student from the microscopic level through the formation of organ systems, with emphasis on the interdependence of these systems. Functional concepts and internal structure are related to surface anatomy as a basis for performing a physical examination. The physiology lectures will provide the overall physiology of the human body, but will also relate how that physiology breaks down or malfunctions in time of infection, disease, trauma, and aging. Medical terminology. This course is a study of medical assistance of a medical vocabulary system. It includes structure, recognition, analysis, definition, spelling, pronunciation, and combination of medical terms from prefixes, suffixes, roots, and combining forms. Medical law and ethics. This is a course of instruction in principles, procedures, and regulations involving legal and ethical relationships among physicians, patients, and medical assistants. It includes current ethical issues as they relate to the practice of medicine and conformity responsibilities. This is a writing-intensive course. Asepsis and infection control. This course is a study of standard protocol for the protection of healthcare worker and patient to ensure that the procedures and treatments prescribed by the physician are performed properly and safely to assist in the patient return to health. CPR and first aid. This course will cover the theory and practical skills of the standard first aid course prescribed by the American Red Cross, American Heart Association, or other certifying bodies. The focus of this course will provide a general understanding the needs of the injured person and, in doing so, give care to the person including CPR until medical help is obtained. Ambulatory. This course is a study that focuses on clinical skills performed by the medical assistant in the back office of a general medical practice. Students will learn about the concepts of professionalism, communication and triage, patient history, physical assessment, equipment and diagnostic procedures used during the examination to assist the healthcare provider with diagnosis and perform appropriate charting for medical record documentation. Introduction and Fundamentals of Pharmacology. This course emphasizes abbreviations and systems of measurement used in administrative drug dosages, federal laws in force to control and monitor drug use, and the legal and administrative responsibilities involved in dispensing, administering, and prescribing drugs. This course also covers the forms of medication available for administration and special patient care applications and precautions. Important aspects of patient safety, medication allergies, and patient teaching, including pediatric and geriatric populations, are studied. Major emphasis is placed on the effects of various drugs on the body's systems. Discussion of most commonly prescribed drugs. Points of emphasis include classes of drugs, actions and uses, side effects, emergency use, and patient education. Introduction to EKG. This course introduces students to patient preparation, EKG machines, performing and mounting of 12-lead, single-channel EKG tracings, review of the cardiovascular system and related terminology, emphasis on basic rhythm identification and possible disease states. Applied EKG. Advanced knowledge of the cardiovascular system with emphasis on the heart in disease states, including identification of cardiac arrhythmias using EKG waveform, interpretation of advanced arrhythmias, hypertrophies, cardiac ischemia, and myocardial infarction is discussed. Clinical EKG. This course provides advanced training which is often required to obtain employment in the field. Cardiac stress testing, artificial pacemaker evaluation, 24-hour Holter monitoring, and advanced cardiac arrhythmia recognition and telemetry monitoring. Students use equipment which includes the pacemaker simulator, Holter monitor recorders, 3-channel EKG recording systems, and telemetry monitors. Introduction to Phlebotomy. Introduction course that explains the fundamentals of today's phlebotomy technicians, such as collection procedures, therapeutic phlebotomy, and laboratory testing. Hematology. This is a basic hematology course that studies the cells of the blood. Time is spent learning the technique to enumerate blood cells, understand the function of each cell, and to learn the diseases or conditions that would result in abnormalities in the laboratory tests performed. Techniques in making and staining a blood smear, along with evaluation and differentiation of blood cell through microscopic examination. Proper methods of blood collections and processing are taught and practiced. Applied venipuncture. This course is designed to instruct the student in the proper methods of both capillary and venous blood collection. Equipment, legal issues, and specimen transport are taught and practiced. Clinical phlebotomy. The phlebotomy clinical expands the skills and experiences at a clinic and/or hospital setting under the direct supervision of a medical laboratory technician or technologist. The student will comprehend and follow procedural guidelines for laboratory testing, including specimen collection, specimen processing, result reporting, and record documentation. Quality assurance monitoring in the collection of blood, complying with safety requirements, and professionalism with patients, coworkers, and healthcare professionals are also emphasized. The medical laboratory. The student is introduced to an area in a healthcare facility where body fluids, cells, and tissues are analyzed. Students are introduced to the medical laboratory and its sections, delineating each section's setup and function. Laboratory Quality Assurance Control. This course explains the importance and need of quality assurance control in the laboratory, with emphasis on the differences between precision and accuracy, use of control when running tests, possible sources of errors, and how to minimize them. Safety in the medical laboratory, lab hazards. This course will cover the potential hazards in the medical laboratory, biological, chemical, mechanical, electrical, fire, and radiation. Discussed in this course is the importance of following all safety procedures and the incident report as part of the safety program. The microscope. The students will know the different parts of compound microscope and its various uses in the medical laboratory. The students are taught how to use and care for the compound microscope. Laboratory measurements. The students are introduced to the International System of Units, the basic units of measurement for length, mass, and volume. The students are taught how to convert metric units to the English system, and vice versa, and perform basic laboratory measurements. Urinalysis. This course introduces the purpose of routine urinalysis and its components. Students are taught how to identify proper specimen containers, how to instruct patients to obtain specimen and proper storage between time of collection and testing. Clinical microbiology. The students are taught the main task of microbiology department, how microorganisms are identified and classified, what types of specimens from the human body are handled, and the different types of containers used for transport of the specimens. HIPAA compliance. This is a short course of study that discusses the patient's right to privacy, the laws and regulations of the Health Insurance Portability and Accountability Act, HIPAA, the governing bodies that set these standards, and penalties provided for non-compliance are also discussed. Externship. Students are placed in a medical facility where there is an opportunity to observe, assist, learn, and perform patient services in an acute care setting. The externship is an essential component of the program where theoretical and practical skills are integrated. Specific objectives, including cognitive, affective, and psychomotor behaviors, must be met for students to complete this course. Career development. This course is designed to assist the student in resume development, soft skills, interviewing strategies, and decision-making skills to assist the student in obtaining employment. Optional externships are encouraged to offer the student the opportunity for a real-life experience. At the end of the clinical medical assistant module, the student will be able to perform hand washing, dispose of biohazards materials, and practice standard precautions. The student will learn how to introduce him or herself in a professional manner. The student will be able to perform telephone and in-person screening. The student will be able to prepare and maintain examinations and treatment areas. The student will demonstrate the ability to prepare a patient for and assist with routine and specialty examinations. The student will demonstrate knowledge of how to maintain medications and immunization records. The student will learn proper identification techniques of how to record vital signs appropriately on a patient's chart. The student will be able to demonstrate how to obtain vital signs. The student will be able to respond to and initiate verbal and/or written communication. The student will be able to respond to issues of confidentiality. The student will be able to perform within legal and ethical boundaries. The student will be able to demonstrate the use and care of patient equipment. The student will demonstrate understanding of theory of medical assistant by scoring a minimum of 70% on the National Certification Written Exam.